How many of your clients do you see on a daily basis who have tight upper neck, specifically our upper trapezius muscles? We try a lot of muscle stripping, some basic techniques, but have you considered a muscle energy technique? Don't forget that our trapezius attaches along at the suboccipital ridge, follows along the line of the neck, and our attachments are right out towards the end of the scapula along that far lateral position. So we're going to try to find a range for a muscle energy technique, remembering that muscle energy techniques are a way to make the muscle contract in order for it to have a new resting length. So we're going to push down on the shoulder until we can feel a point of bind or the resistance where that muscle is telling us it's tight. So that's about where I'm getting it from Rosalind. And then I'm going to increase her lateral flexion until I can feel that point of bind with my fingers underneath her occiput. Once you've established a position like that, you're then going to get your client to push up into your hand at about 40% of their effort. And that will encourage the distal fibers of the trapezius to work. So we've got that contraction for about 7 to 10 seconds. They normally take a cleansing breath in, and as they breathe out, they're going to relax the shoulder completely. This is where the magic happens, everybody, because we've got at this stage, it's our reciprocal inhibition or our resting phase where the muscles will then get a normal length. We can last up to 90 seconds here, but normally therapists don't. Let's add a bit more to that technique by adding neck lateral flexion into the move. So down to bind again, coming across to bind at the superior or proximal area. Again, Roz, can you push into my hand? Now push your left ear into my forearm. So can you see now we've got a double end contraction? The things that you need to be aware of with these kind of moves is do not let your client change position. So it's really isometric or isotonic. Big breath in, Roz. And relax on the out breath. On the out breath, can you see there's no movement? I haven't pushed further or pulled further. We're allowing for that lovely rest stage for our pathological length to improve. Again, we're going to come down a little bit further. New point of bind. New point of bind. Establish you as a therapist, your arms in those positions. Tap the shoulder to make her engage up. Tap the head, and we've increased that contraction times 3. Fabulous for conditions that will create suboccipital headaches as well as neck ranges of movement. We've got 10 seconds. Breathing in, Roz. Breathing out and relax. We can use muscle energy techniques anywhere that you're aware of a muscle being tight. All you need to know is your origin and your insertion and your action. And you can make huge changes to the quality of the resting length and any pathological problems that your clients have with their musculoskeletal conditions.